and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, I have with me Linda Burks. She is the Medical Student Director with West Tennessee Healthcare, Henry County. Welcome to the show, Linda.
Hey, thank you very much.
Thanks for coming on with us. Now, is it Henry County Hospital?
Hospital,
Yeah.
yes. West Tennessee Healthcare, Henry County Hospital.
Yes. So, this is your first time on the podcast, and, Henry County's new to the West Tennessee healthcare system, so we're just excited to get to talk to different people in different aspects and get to hear and learn about some things going up in Paris, Tennessee. So first, we just want to get started with, tell us a little bit about your role here with West Tennessee Healthcare, Henry County Hospital.
I started with the medical students in 2021. We rotate LMU, DCOM, which are DO students in their third and fourth year of medical school.
Yes.
So setting their schedules and things like that is what I do for the hospital.
So you mostly work with DO students or,
Yes.
or only?
Only.
Okay.
And PA, Bethel PA students.
Okay, great.
So
And, that was kind of something that I recently discovered is a famous doctor on YouTube, Mike Vershovsky, is a DO. And that's how I found out, because I was I only had ever known about MDs, and I'd never heard of DO, which is a doctor of osteopathic medicine.
Correct.
Which is basically the same thing, but just with a little extra
With a little
hands-on.
extra. Different tests. They do take the same tests. They can.
Yeah,
As
okay.
MDs, the steps, but they do take the level tests.
Yes.
On the complex.
Yeah, because I interviewed Dr. Megan Tuttle.
Oh,
up
yes.
there
She
in Henry
works.
County.
She's
So,
actually one of our preceptors for our medical students.
I had a feeling. I was like, I bet she knows her,
You
because
know,
Henry
yes.
County's pretty small. So.
And she was in our first graduating class when we started, when Dr. Finley started up the medical students.
So we had to shout out to Dr. Tuttle in there.
Huge shout out. Huge.
Which she was great. So what led you down the path to working with medical students?
Teaching. I taught high school for 7 years.
Oh, okay.
And I was a med tech.
Okay.
Laboratory for 9. So just mixing the medicine that I love and then the teaching I love. So when this job became available to help Dr. Finley, I applied, and she's like, I think you would be a perfect fit.
Great.
And I've loved it ever since. It's 4.5 years now?
Yeah.
So
Great,
absolutely
And it's
wonderful.
always fascinating to hear how people arrive at, kind of where they are now.
It's just a good mix.
Right, yeah.
Perfect timing.
That's what I was just saying. It all kind of worked itself out.
It did. Perfect timing for me and my family and everything.
Right. So when students come here for their rotations, what are some key things you hope they take away from the experience?
Rural medicine. They wear several hats.
Right. Yeah.
They
Because it's a smaller town, and so the facilities are smaller, and
But they, in my opinion, they learn more.
oh, right.
Because they get to be first assist in surgery. When they rotate, of course, for the third year med students, they have to rotate in general surgery and selective surgery. And a lot of them pick electives with ortho, and we have great urology physicians in Henry County too. So
and that's good, because it's like you have more of a well-rounded approach. And
Right.
I guess you're not as thrown by things, because you've kind of get a snippet of everything.
They see everything.
Right, yeah.
And they get to get in there and work. Very hands-on.
Right.
They don't have to. And I've had our new director of student medical education is Dr. Whitby. Dr. Gallimore is finishing up at the end of June.
Okay.
And then we're going to have Dr. Whitby 1st of July. But Dr. Whitby's stories of UT Memphis, being a third-year medical student behind all the residents, and then the fourth-year med students, and then him.
Yeah.
So he's on his tippy toes
nice-
watching the surgery, where here in Henry County, the students can actually participate and help right side by side visually.
And I feel like that's so much better than, reading in a book or going to a class, like the hands-on
It is.
aspect.
And you want doctors to be well-rounded.
Exactly,
And well-practiced.
Right, exactly. So I know you said you've been here for about four and a half years, and you've helped guide students through the big milestones, like the white coat ceremony and match day. What do those moments mean to you?
Oh, those are probably 2 of my favorite.
So you get to kind of watch them
True.
from
I
the
get
beginning to the end,
I get to
guess.
schedule it, I plan it, and of course the preceptors help them pick a case, an interesting case. For example, on a poster presentation, even though that wasn't part of the question, poster presentation in March.
Okay, yeah.
Where they can present their favorite case.
Okay,
And
yeah.
so everybody can learn. So that very much teaching, learning environment. Now, match day is wonderful. It's usually a whole week process for these med students.
Now, what does that specifically mean?
It's a week. They go through audition rotations.
Okay.
And they pick the specialty, and it's hard sometimes between third year and fourth year medical school to pick a specialty.
Right, yeah, because I always wondered about that, like how people wind up where they are.
Well, usually they go in as like, I'm going to do ER. I love emergency medicine. They're like, well, I kind of like internal medicine.
Yeah.
Or family medicine, or pediatrics, or even surgery. I mean, we've had 51 students, med students, DCOM,
Wow.
LMU DCOM students go through Henry County. And we've had we've had one going to OB.
Okay.
And one going to pathology.
Nice.
But match day is usually on Monday of a week, and it's about mid-March. They find out where they match. So they rank programs, residency programs, and the residencies match them or rank them.
Yeah.
And the system, whatever computer system it is, puts them together as a
I
match.
like that myself because it's like,
it's very
help get me to answer questions.
Random, yes.
Yeah, get me to answer questions and then tell me so I don't have to
Last
decide.
year we had a student end up in Des Moines,
Okay.
Iowa, internal medicine. So she's never been to Des Moines.
Okay.
Because a lot of these residency interviews are virtual.
Oh, you're right.
They really never, sometimes they don't ever go to the place, but they end up loving it. We had one go to Oregon, absolutely loves it.
Nice.
We do hope that she comes back.
Yeah.
And match day and which other event? Oh, White Coat.
Yeah, white coat ceremony.
That's every April. Like I say, Dr. Tuttle was in the first group. It was April in 2021. But every April, we have a ceremony to thank them, basically, for coming here and being part of our community.
Right, yeah.
I mean, we give them white coat. We basically give it with their name.
Yeah.
And their specialty that they've matched in.
Right.
So they can have that for residency. I know residencies get them a coat or two
Yeah.
to wear, but they can wear the one from us too and maybe put their other
on the other
location
side.
on it. Yes.
Yeah.
But it's been great to watch them mature
Yeah,
and go through these things.
So I know you've mentioned kind of what it's like. Do you have a story of a student who really stood out or someone whose journey reminds you of, why this work matters?
Almost all of them.
Other than Dr. Tuttle?
Probably all of them. Probably all of them have their own special story. And one last year, I asked her what her hobby was, and she was like studying. Because she started med school, not struggling, but, having to really put herself out there and really concentrate and study. But she just succeeded beyond.
Yeah.
But just, like I say, watching their maturity.
Yeah, I was going to say, you can, prove to yourself what you can do, what you're capable of, kind of overcoming your own obstacles, I guess.
So these are I call them kids, I guess, because they're about the age of my kids, but
and when you're a teacher too, that's kind of like all your kids. Yeah,
exactly. So, but just their maturity. But they come here and they've always been in school.
Right, they go straight.
A lot of them do, unless they had to wait a year or two to get into a med school. But but they've been schooled their whole life.
Yeah.
And how here they're trying to have to be hands-on, clinical.
Yeah.
But watching the interaction between them and the doctor, and them and the nurse and the staff. I mean, the big
and just a whole
system
new generation of
kind of comes together.
Medical providers,
exactly.
And as someone who's in their mid-30s now, I haven't been in school like I just did 4 years of college and then I left. I still to this day have dreams that I'm in school.
Yes.
I can't find my class. I can't find.
You're late.
I can't find my roster. I don't know what day I'm supposed to go to this class.
Yes.
For the past probably 5 years, I've been mentally in a master's program that 100% I don't pay. I don't go to any of those classes. But each time I dream it again, it's like a continuation of the last dream.
Yes, you pick up where you left off.
I told my husband, I said, I've been trying to get this dream master's for a while. 100%. They're not letting me graduate. I don't even know where my classes are.
Not on the dream, but congratulations on the final.
Yeah, I was like, I wake up, I'm like,
the final product.
Thank goodness that's not real.
Amen.
So I know you mentioned working with preceptors, and I know, I watch medical dramas, but I'm not clinical in any way. What is a preceptor, and how do you find support? How do you find and support the doctors who help teach our students?
They're boarded or past boarded in that specialty.
Okay.
For example, our third years take internal medicine for 2 blocks, family medicine 2 blocks, pediatric, psych, OB, general surgery, select surgery, GME, all of those. But finding someone, and I tell you what, doctors are natural teachers.
That's good, yeah.
They convince us as patients to do things.
Yeah.
And they're good at social, most of them. Even if they're not social, they're very good with the words. But they're able to communicate well. But the preceptors, Dr. Finley and Gina Matlock got most of them set up. Now, we picked up one this week.
Okay.
That is a doctor in a clinic in Henry County.
Okay.
So it's just emailing them, asking them, calling them, going to their office
reaching
and
out,
seeing if they want to. Because like I say, most of them want that extra opportunity to teach.
Yeah, and have you seen any creative ways our providers are helping students learn and grow, like on the job?
Always. their own stories.
Yeah, and that's a good thing I've noticed, the way, medicine constantly evolves, and just having an open mind as a provider is always good.
But them sharing their stories, even their struggles, not just med school, but in residency.
Yeah.
One of the great surgeons we have in Henry County, he remembers a day in med school that had a nurse point out, and like, "You're not going to make it." And he's like, "What?" And he ended up being a great surgeon, but you could tell. I mean, just getting through stories like that and people's comments, and
you hear things like that where people, they have a very successful career, and then they're asked to speak, and they tell a story about, when I first started, everyone told me I wasn't going to make it, and that's awful to say to someone, but then in a way, it's like if you can persevere past
it was a motivator for him.
Right? Yeah.
I mean, it helped him jump a hurdle that he thought wasn't going to happen.
Yeah.
But so many stories, but their past experiences and telling their weaknesses and their strengths.
Yeah, I was going to say the weaknesses,
the struggles,
and
but
the strength. Yeah,
victories
that helps shape you. If you never had any struggles, it's like you don't have anything to base.
Right.
Some of the times it's like you needed to learn it a certain way.
You do
to have to
it's
have
not
to
all
stick
utopia.
better. Right. Yeah.
Right.
Exactly. That's not what life's not perfect.
No, it's not.
So besides their clinical work, are there any special projects or learning experiences your students get involved in here?
Like I said, the poster presentation.
Yes.
And then, of course, orientation. We go through everything, but community events, they're able to be involved in community events.
And, just showing up, letting people know that they're there, who they are, and getting to know, because you want to be able to know your provider. Right. I just went and saw a doctor the other day, and I was like, I don't know why I'm nervous to talk to them, because in the past, I had a doctor that kind of was like annoyed that I was there, and now I have this like PTSD of like a doctor's going to be annoyed at me, but it's like as a patient, I know that is a thing where people are like maybe afraid.
I've had students many times. Yeah. They'll go into.
And you'll just try to have to like push past that as a patient to say, if it's a good doctor, they're not going to be annoyed that I'm here. You came here for a reason. Let's talk about it.
I've had student stories say they go into a room with a patient and tells them the story, ask them everything that's going on and all that. The doctor comes in, the patient has a totally different story. But, as patients, we get, you get nervous. And
what I like to do is I
pass that test.
I write a note on my phone. I'm like, let me prep. Because then when you get in there, it's like you go blank.
You do.
Having that note on your phone, like, let me pull up this note.
And it's just hearing the students talk about things like that have happened in patients' rooms.
And it's always hard. And I feel like Henry County might be a little bit different since it's more rural and there are not as many people, but I know it's hard when a doctor only has a certain amount of time with you.
That's true in Henry
As a
County.
Patient myself, I love to talk, as you can probably tell.
Yes, and I do too.
When they walk in the room, I'm like, okay, when I was 3, this happened to me. You want to tell them, like, they'll hear what you're like, this is what my complaint is. But let me tell you my whole life
relevant
history.
now.
Like, does this have anything to do with that? Is it anything to do with this? So, So do students get a chance to learn through things like simulation training or telehealth while they're here?
Simulation, we have a central line. It's like a head and it's got the veins and different colors. And
so central line.
You're putting...
So that's if you needed to put... I've heard that.
Yes. I mean, I've watched them with
like
the simulation.
In your neck, I guess,
yes. But it's more of like not a simulation, like computer simulation.
Yeah, so like a model.
Model. Yeah. Thank you very much. Central line, intubation.
Yeah, intubation I know is
Vanderbilt
a big thing.
Once a month either comes here or comes to Henry County and does an iFly to show them the helicopter.
Okay, yeah.
Or they came last time for an AMBU. It's an intubation model.
Okay, yeah.
That the students got to watch and practice on.
Yeah, because that's always a good
adult,
thing.
Adolescent and infant.
Okay, yeah. Because
so they can practice on all.
You can learn about it. You can watch a video on it, but until you've done it hands-on, you want to be able to have a test run at least.
Yes. And telehealth, yes. We have several physicians and clinics that actually use that as a tool.
Yeah, great. So training in a rural hospital like ours is a bit different from a big city. How do you prepare students for that kind of hands-on personal care? I know we kind of touched on that at the top about how it's kind of completely different than a big city hospital.
Right. One day at a time. Do your best. Get in there, hands-on, ask questions. They can always tell pretty quick if the doctor is good with a lot of student questions. Some are.
Yeah.
So they kind of learn in that first few days if a lot of questions can be asked. Because there's some that are very much teachers.
Yes, yeah.
I mean, they are like... when it comes to teaching and being a past teacher and teaching strategies, I had to teach one of our doctors to give the students think time.
Yeah.
Because they know it instantly. They know the answer then.
Right.
You're going to have to give that student 5 to 10 seconds. So you got to count in your head.
Right.
Give them time to think and go through the processes of whatever diagnosis they're talking about so they can actually give a correct answer. So that,
you have to just remind people sometimes. Some people just have to be reminded,
Because they'll prep because there's a new third years. They start mid-July. They start in like 3 weeks.
So, yeah.
And so one first rotation is an elective in orthopedics. So you're going to have to really kind of look at all the nerves and muscles. You're going to have to I know you learned it and you passed the test, but you're really going to have to go back and review before that rotation.
Yeah.
Because like I say, it's one student, one doctor. There's not like 3 or 4 or 5. There's not several like in the shows we see on TV, following them around or teasing with them. As you're there. If they ask you a question, what nerve intercepts, what you can tell them.
Yeah,
or try.
Yeah, Scrubs is one of my favorite shows.
Yeah, me too.
So
one.
You talking about intubation,
the comedy.
So Paris is a special place, and events like the world's biggest fish fry are part of that culture. How does our community help shape the student experience?
They get to volunteer at the fish tent. They do every year. There's 1 or 2 every year.
That's got to be such a special and interesting opportunity.
You see
for
tens of thousands or 10,000. I think like maybe 14,000 this year. I don't know, but they get to volunteer for that. Mm-hmm. The Tennessee River Jam just ended. And so they got to participate, not volunteer, but they participated in that.
Yeah, great.
The Henry County High School has a career fair.
Okay.
We do every year. Yeah. The students go talking about the hospital, what's available, and then, of course, pushing some of these high school students to go for medical school or a medical career.
If you had any questions, it's like, we're here to answer.
Exactly.
What it's like. So you can know, like, is this even something I want to
get
involved in?
Even the fair coming up in August, the Henry County Fair is in August. They'll volunteer on a Saturday to show the community what they do and talk to them and any questions they might have. So
great,
they become involved.
Great, yes, that's good. So what's next for the medical student program here at West Tennessee Healthcare Henry County Hospital? Are there any exciting changes coming up?
Like I say, the new DSME will be Dr. Whitby. Working with AI more.
Okay,
I know that's the biggest. They use, there's an AI app, Open Evidence. That's
Open Evidence. Okay.
Open Evidence is what they've been using for the AI.
Okay.
Just to kind of ask it questions, and then you could ask follow-up questions.
But,
But changes for the program, getting more preceptors is what we've been doing. We're still going to take just 6 of the LMU DCOM students per year.
Okay.
And then with the Bethel PA, there's about 8 per year. Bethel PA students start clinical rotations in January, where the LMU DO students start rotations in July.
Right, yeah. So is that...
the DO's 2 years.
They're coming from college, I guess?
Bethel PA? Yeah. Yeah, it's across the street from Henry County Hospital. And it's a PA program that's like a 27-month program. The first year, of course, classroom. Second year, clinicals. And so I take them through orientation in January. And place them in rotations at the Paris site.
I did a Bachelor of Arts, so I don't know anything about the science stuff, and then I'm like, so and it's been a hot minute, so I'm like, let me ask her, because
your face kind of went like, what?
And my thing is if we're talking to the community, I'm the voice of the community, and being like, what is she talking about here?
Well, good question.
Because you're in it every day. So, because Kara's like, what's happening?
I do. I love it.
So I think we already pretty much covered this about the new tools or trends in healthcare education, like AI. Mm-hmm. We talked about AI team-based care or telemedicine. So what advice would you give to a student starting their first clinical rotation, especially ones coming into a smaller rural hospital like ours?
Funny thing is, they love the no traffic. I'm just thinking about students that come from cities and they come to Paris. They're like, oh, does it take me an hour to go 5 miles?
I lived in Nashville for 2 years, I'm grateful every day that since I've moved back. Oh, that traffic was.
I didn't think I'd like it either because we lived north of Nashville for years. Moving back to small town, but getting them ready for just the community. Yeah, community loves it,
right? Because it's it's almost like you don't meet a stranger. No. You're not anonymous.
They're like, oh my goodness,
you're not as anonymous
as
you
somebody at Walmart.
Yeah.
Like, yes.
You're going to run into the people.
Exactly. Yeah. Wave back. I'm like,
exactly. How to because I mean, some people, if you grew up in a big city where nobody looks at each other, no one
Right.
talks when they walk by, you know, it could be startling for some people. Yeah,
But,
depending on
but getting them ready for a small community, but they're ready. They've got a lot of studying to do.
right. Yeah.
Like when they come to us, they're finishing their first test.
Okay.
To be a physician, there's 3 tests.
Okay.
There's 3 board tests, one after their second year,
Okay.
and then one between their 3rd and 4th year of med school, and then one between their 1st and 2nd year of residencies.
Okay.
And residencies can run from 3 years to 7.
Oh, okay.
If you're internal medicine, family medicine, peds, 3 years to 7 year for orthopedic surgery.
I was going to say the more specialized
The more
ones, yeah.
specialized ones are more.
Are
Like even
longer.
pathology could be 5 years.
Oh, yeah.
If you specialize.
Because I've always wondered, like I always heard, like when I was a kid, medical school is like 8 years. It's kind of like you got to try to
Past that.
see. Yeah.
You think undergrad.
They say 8, and then it's like,
medical,
well, then you have this.
and then you have 15 years. So,
Yeah.
okay.
as you go through the steps.
Physicians have my great respect. I mean, they have
Yes.
fought.
It's a journey.
Upward bound. I mean, they
Yes.
are fighting that struggle day by day.
Right. So looking back on your own journey, is there a moment or a piece of advice that stuck with you over the years?
Be patient. I always tell my students, be patient, enjoy the journey.
Yeah, I was going to say, 'cause it can get hard.
It
I
is a
imagine.
journey.
Yeah.
Yes.
That there's are probably going to be moments where.
They all come to my office, all of them, at least a couple times, crying, why in
And
the world am I
having-
doing this? And
having that
encouraging
person,
them.
so like your position, having someone, like for you specifically,
Yeah.
the way that you are, you allow those people to say, I feel comfortable coming to her.
My door's always open.
And
I
that
have the
way, you
tissue
just
ready.
have to get out your feelings and not be judged. Like I
Yeah,
think
no,
that's an
exactly.
amazing, because I feel like more people wouldn't make it as far if they didn't have someone in a position where they felt comfortable.
They have told me that. I
coming with
get
and sharing.
thank you notes all the time.
Yeah.
From
And those
students
are
that are in residencies now going, I could not have made it without you. You helped push me through.
those are the moments I
and helped
remember
me.
in school, like when it gets tough, just having someone there that's
Exactly.
non-judgmental and there to
I
listen.
tell them if they're
and
going to
help.
have a breakdown, come to me.
Yeah, don't do it out in
Don't
public.
do it out. Don't do it in front of the patient. Don't do it in front of your
I was
preceptor.
like, I'm here for that.
Exactly. Come to me. We'll talk it through. I'll encourage you and, push you back out there.
Yeah, right, exactly. So as we wrap up, do you have anything that, you want to share about what makes you most proud about the program you've built here in Henry County?
Well, working with Dr. Finley, who started it back in 2019.
Okay, yeah.
And then Gina Matlock. But working with those ladies.
And, I guess
and
seeing
all
how
the
far it's
students,
come. And,
it's come such a long way.
right, yeah.
And just sustaining it, keeping it going.
Yeah, and just having it there, and,
Because we have 28 students when you think of all the PAs and the med students, and then about 30 preceptors.
cool, yeah. All right, well, thanks for stopping by and
You're
sharing
welcome.
all this information. There's so much that goes on behind the scenes
There is.
with hospitals and healthcare and providers that a lot of people don't know about. So this was a nice little insight into becoming a doctor. There's more than just getting a white coat and walking and getting your
Exactly.
certificate and walking into an office.
And be competent and kind.
right, and all the training and the studying that
And
goes
to,
on.
and to help us in the rural community.
Right, exactly.
Especially with West Tennessee Healthcare.
yes.
Joining them was a huge benefit for us because,
Yeah.
that kind of expanded our world.
Right, and yeah, now the access to the tools and
To
things.
the tools, exactly.
Yeah, so looking forward to many more years of this program, and
Me too.
thank you so much for coming
You're
on
welcome.
and sharing
Thanks,
all this
Kara.
info. Thank
You're
you.
welcome. Bye-bye.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.